is an honor to be here and to speak alongside other prestigious speakers and scholars. I think there might be some overlap between my talk and some of the issues that were touched on earlier by Professor Dumitru and Sorin. So I'm very sympathetic to most of their points. Perhaps my background is not so much Neo-Aristotelian, but more like Kantian. I'm a philosopher, as you can guess. My background is primarily, I started with existentialism and phenomenology, philosophy of Wittgenstein as well, philosophy of language, some issues in epistemology. I've also done some work, a little bit of work in the area of philosophy of religion, and currently my work focuses on issues in bioethics, philosophy of mental health, philosophy and ethics of mental health. And I'm currently based at the Institute for Mental Health in the School of Psychology, something new for me to be. It's the first time I'm in a department which is not philosophy. My work is interdisciplinary. I consider myself to be like an in-betweener or someone who likes to build bridges, sort of interdisciplinary worker. My talk today will reflect all this background and influences. So I will start by briefly mentioning some aspects of my talk today. So as you have realized, I have like a sort of eclectic approach, which is at the intersection of bioethics. The topic of vulnerability is a topic in bioethics. Existentialism, and you'll see I will talk about an existential notion of vulnerability, and I'm interested in asking the question as to whether artificial intelligence or religion can help in relation to our vulnerabilities to mental health. So I will begin by indicating how artificial intelligence might be seen as like a very rich resource we can draw on in areas such as not only education, as mentioned earlier, but also healthcare, due to important similarities between particularly human-like, for example, robots and like robots and us. Similarities that concern bodily appearance, for example, intelligence, motility, also material limitations, and even perhaps emotions and empathy, as I will indicate in a minute. So in relation to artificial intelligence, I consider the issue as to whether humanoid robots and the humanizing of artificial intelligence might enable these robots to take up roles in contexts such as education, medicine, healthcare, and in particular mental health services. And then in my talk I will also consider some aspects of the relation between religion and mental health, and whether religion or AI might be more helpful in relation to our vulnerabilities to mental health, mental distress and mental illness. So, there are a number of similarities between human-like robots and us. In the picture here, you see one of these robots, Sophia. I'm not sure whether you've encountered her on social media. She was also interviewed. She has a presence like a human sort of shaped presence. Here you can see her on the cover of a fashion magazine, The Stylist. And she also appeared in many interviews, including an interview at Oxford when she visited the University of Oxford. She had interviews with students and staff who talked to her about various topics. Perhaps yeah, you've come across another humanoid robot, Ada. Yeah, she was interviewed. She discussed with members of the Parliament in the UK about art and the use of AI in art. So these human-like robots, they have a bodily appearance which is very much like us. So on the cover, you wouldn't tell the difference between Sophia and any other woman, blonde woman. I mean, in terms of like shapes and general features. They have display a high level of intelligence, competence at the level of us humans. Their emotions, then again, in many ways, their behavior resemble our behavior. We can also think of various material limitations as being another aspect of the similarities between them and us. We sometimes don't function very well when, I don't know, say a limb is broken, and when they have a dysfunction, then also the physical limitations are manifest. And there have been great advances, and these human-like robots can also express emotions. They have like facial expressions which resemble very much human emotions and human behavior. And because they are able to have these emotional responses to specific situations, we can wonder whether they can also manifest empathy. And this is an important topic, as particularly in the area of healthcare. So there are important similarities, but also there have been important features stressed in debates concerning the differences between human-like robots and us. Free will, self-consciousness, motivations, intentionality that have been discussed. Some of these have been discussed in the talks earlier. But I don't want to focus on this aspect which can be seen as powers of human being. I'd like to focus on a different topic, namely that of vulnerability. So, what about vulnerability? Is this something that constitutes a similarity or difference between artificial intelligence, human-like robots, and us? So I think vulnerability is definitely an aspect, from my perspective, in my view, it's an essential aspect of the human condition, and can be seen as a universal feature of human subjectivity. And so I agree with those philosophers who talk about vulnerability or fragility, who think that these features are essential aspects of human existence. And I understand vulnerability as an openness to being wounded, an openness to suffering, to harm, and which can take various forms. For example, human being is vulnerable to mental distress and suffering, to mental illness, which are experienced, for instance, in anxiety, depression, psychosis, or addiction. So, some general discussions about vulnerability are concerned with this universalist notion of vulnerability, according to which we humans are all vulnerable in some way or another due to loss of health, dignity, material things, the loved ones when they die, loss of home, loss of country, loss of other goods or capabilities when one is affected by illness or some form of disability. Being vulnerable would also mean being less able to resist or to tolerate potential harms and wrongs that are inflicted on us. So, as I mentioned, this is a universalist conception of vulnerability, according to which vulnerability is taken to be an inherent aspect of human condition. For example, from the postmodern camp, Judith Butler argues that corporeal vulnerability and social precarity are constitutive of the condition of human being, and it is important to investigate this critically because these aspects raise fundamental ethical and also political issues. McIntyre and Nussbaum also endorse a universalist view according to which vulnerability, which is connected to our animality and sociality, is an inherent feature of what it means to be human and is central to moral and political thinking. So these discussions are in the area of ethics, bioethics, but also in the area of legal theory. Scholars like Feynman argue that vulnerability is, as she puts it, a universal, inevitable, enduring aspect of human condition, and she argues that vulnerability should be at the center of legal and political discussions concerning inequalities and also the development of social policies and the implementations of these policies. And these are interestingly developed in a recent volume co-edited by Mackenzie, Roger, and Dodd. So moving on, I'd like to sketch here an existential conception of vulnerability, which further develops this discussion in the area of bioethics, but also by drawing on some phenomenological existentialist insights into this aspect of the human condition. And as I mentioned, I understand vulnerability as this openness to being wounded. And the notion of openness here is an existential sort of way of making sense of things, an existential openness to the world, an openness to be and live, which is marked essentially by the possibility of being wounded, harmed, and in many different ways, a possibility of suffering. We are vulnerable in multiple ways. We are vulnerable to others, we are vulnerable to the world, we are vulnerable in relation to ourselves. In relation to others, we are vulnerable in many ways. So vulnerability is a social phenomenon. It's not just individualistic feature of the mind. It's a social aspect of human interactions. For example, we can see how vulnerabilities manifest in stigmatizing attitudes, particularly in relation to mental illness. So many people who have various mental illnesses, such as psychosis or mental distress due to addiction, they experience stigma. And vulnerability is also manifest in our relation to the world. It's an aspect of our being in the world. We can be affected in many ways by the environment and by our interactions with the environment, so it's a contextual feature. And we are also vulnerable not only to others, to the world, to nature, but also to ourselves. We can make sense of ourselves in ways which can harm us, can make us suffer. For example, if stigma is internalized, then we experience self-stigma, and that has an effect on us which is harmful and causes suffering. So, in particular to this discussion in philosophy of mental health, I'd like to point out that as a human being, and health in general, I want to be vulnerable to somatic illnesses and also mental distress and suffering experienced in various disorders. Anxiety and depression being perhaps the most prevalent, and psychosis one of the most serious mental conditions that we can think of in this context. So vulnerability to mental distress or illness, I suggest, can be understood in existential terms as a lot of possibilities to interact with the world. So for example, when we are depressed, then we might experience a fatigue, a lot of interest in interacting with others. We might experience a sort of tendency to self-isolating and to withdrawing from the world. So that's a way of in which we lose some possibilities of interacting with others and the world, and a manifestation of vulnerability to mental distress or illness. Now, could one attribute vulnerability to humanoid robots? I would suggest that humanoid robots do not seem to be vulnerable. They have various physical limitations, material limitations, but they do not seem to be open to being wounded and to suffering. So, in relation to the area of mental health, I'd like to stress that humanoid robots are not vulnerable really to mental distress or mental illness. Mental distress, for example, depression, is not simply just a faulty mechanism, is not just an error or in the workings of our brain. For example, depression has also more to do like with the social environment or perhaps personal history. So it's not just a matter of a dysfunction of the brain or of some biological mechanism. And thus, we can't really see how we can attribute suffering to humanoid robots because, they don't have all these other facets of existence that we have. So it's also because of this consideration, I think it's difficult to see in what sense humanoid robots can manifest empathy towards others if they're not vulnerable, if they cannot experience suffering, if they're not vulnerable in the existential sense that I mentioned earlier of losing capabilities and losing possibilities of being in the world. Someone can be considered to be empathic or capable to be empathic if they can be considered to be existentially vulnerable. So I think vulnerability then can be understood as a precondition of empathy towards others, a precondition of understanding others in everyday and healthcare context. Hence, vulnerability is an essential aspect of human subjectivity which cannot be shared by humanoid robots. So, human-like robots cannot be subjects like us in this respect. So, what might be some implications of this consideration with regard to the use of AI and artificial intelligence in mental health? There might be, arguments in favor of the use of artificial intelligence in mental health, given their performance and perhaps, issues considering the costs and the needs of services in mental health. And these aspects are currently discussed in philosophy of mental health, the ethics of mental health. But I think, it is important to think about the implications for these issues, to think critically also about the implications for these issues concerning the use of artificial intelligence in mental health care. And one of the main problems or risks that have been identified is the issue of the dehumanization of healthcare. So if we think of psychiatric care, we think of the interaction between patient and clinician, and we take this human encounter to be very important for the treatment, diagnosis, so all these aspects of the clinical context. But perhaps one might argue that human-like robots, such as Sophia, maybe they can help us because they so much like us, they look like us, then they might help some issues concerning the dehumanization of healthcare because of their similarities with us humans. So from this perspective, one could think that humanoid robots are to some extent humanized because they look so much like us, they look like as though they're human, and we sometimes interact with some devices or artificial intelligence equipment as though they have a life or an existence, and we talk to them, or respond to them, perhaps sometimes even in emotional ways. So one could think that humanoid robots in particular are humanized, and thus they might not be just smarter, performing more highly than us, and than mental health professionals, but also they could perhaps to some extent manifest empathy through language, through their facial expression and behavior, through their intelligent responses, and thus they can be used in mental health care in contexts which also even require empathy, empathic interactions with service users, with patients. So I mentioned earlier that in my view we cannot attribute empathy to human-like robots because they lack vulnerability, they lack this openness to suffering that humans have, and thus it would be sort of like a category mistake to attribute empathy. But I think, the debate could continue, and I'd be interested in hearing your thoughts if you want to comment in the QA session. So, so just a few more minutes on religion, vulnerability, and mental health. So perhaps one could think, so if one accepts my argument, then one might think that maybe a more productive way of addressing the issue of humanity and care in mental health can be approached through an engagement with religion and spirituality. If we start off from a belief in the immanence of the divine, which is a view, for example, supported by Michael Tim Mawson and many others, so if we accept this belief can also entail a belief in divine vulnerability, which connects God to humanity, to human existence. A suffering God can be seen as a source of support for people with mental distress. For example, for those affected by depression, the presence of and the belief in a suffering God can give one a sense of solidarity, a sense of being together with a divine presence, which can help one deal and make sense of one's mental distress. And here is a quotation from Tasia Scruton from her book on depression and Christianity. Here she says, taking Christ's solidarity with those who suffer as our example, the best first response might involve simply being with those in distress, rather than offering any kind of advice or explanation. So just being in the presence of someone who listens, who pays attention, could have an impact on the sufferer that cannot be perhaps replaced by the presence of a humanoid robot. Moreover, I think it can be argued, and this is what Tasia Scruton argues, that in some cases the experiencing of mental illness incorporates an experience of God or a spiritual experience, for example, of enlightenment or transcendence or love, a deep love towards others. So in that sense, in relation to mental distress that Scruton considers, which is depression, suffering in depression can be potentially transformative, can develop certain attitudes or possibilities of being which can have an enriching impact. So this consideration can constitute, I think, a starting point for an investigation which explores the therapeutic value of religious practices and beliefs, a therapeutic value which is based on shared vulnerability. So I'm just concluding here that now on in relation to my initial question. So my proposed response is that in relation to artificial intelligence, the issue as to whether humanoid robots and the humanizing of artificial intelligence seems to enable them to take up roles in contexts such as medicine and healthcare, mental health. But I think there is a risk of dehumanization of this area of healthcare with the use of AI in mental health care. And I suggested that perhaps in relation to mental health, a beneficial sort of way of approaching the issue of vulnerability in mental health is to consider the therapeutic value of religious beliefs and practices which are based on shared vulnerability. Thank you.
Thank you. Thank you very much.